right, welcome to the Ophthalmology Quarterly Release Review here at Nextech. Hopefully you are excited to get energized here with the football season starting, and nothing like the GOAT of football, Tom Brady, talking about the GOAT of PM and EMR software today. Real quickly, Jeff Wahlberg here, Regional Sales Director, Ryan Montalvo, our Senior Solution Engineer. Excited to talk through some of the newest and latest with Nextech. Just again, our mission statement here at Nextech is simplifying the delivery of excellent patient care. As you can see, Nextech as a whole serves over 16,000 providers. It's actually about 7,000 providers in eye care alone. And this map right here just represents some of the large private equity groups that use us today. But be reassured, we have a very large amount of large practices that are independent, as well as startup practices. Priced for you as you're starting up new practices. So Nextech's ophthalmology solution defines innovation. We're all about simplicity, streamlining workflows, chart innovation, always making the chart easier, more intuitive for those providers and clinical scribes. Unmatched service and support with call times less than 3 minutes, 24/7 US-based phenomenal support system to the product. And then lastly, just a patient experience like none other. Patients enjoy this software, being able to check their clinical records as well as fill out information before coming into the practice. I'm going to pass this over here now to Ryan, talk a little further about some of the newest and latest.
Yeah, so now we're going to hear from the Jets fan here, and we're going to cover again some of the newest, latest, greatest enhancements here at Nextech. Just to name a few that's listed on this page right here, we're essentially making data-driven decisions, the ability to track the high and low performances with our financial performance dashboards, much more simplified. We're able to reduce costs to collect revenues with our ERA payment automation. We can highlight those open referral loops, very simple, with our referral dashboards. And last but not least, saving those third-party costs with our online scheduling. Now, what we'll do here, we're going to stop our video screen here and actually perform a live demonstration on these new enhancements. Now, on this page here, this is our Nextech EHR dashboard, where on the left-hand side, you can review your schedule of all the patients listed for today. And as you click on that patient and select on IntelliChart Pro, that'll then launch our chart record. Towards the very top of the screen, what we actually have listed here is a list of all of our previous appointments. Now, very simply, we can review all of our visions over time, pressures, ocular medication history, and any diagnostics performed. With this dropdown, you can actually review all of your past billing codes that you've ever submitted through Nextech's EHR. Now let's scroll down a little bit further within this single page display. And then you'll then take notice these orange cues that are living next to the nerve. And we actually have another one living just a little below next to the macula. These are all of your MIPS requirements. Now, on the left-hand side, our quality tool is actively tracking these metrics for you with every patient encounter. By identifying and documenting your metrics for today, on the left-hand side, that quality gauge turns green to ensure that we've met those measurements. By selecting on any of your clinical subsections, in this case, lens, that chart header drops down and will display all of your lens findings you've ever interpreted historically. And it'll include all of your visions so that you can see if there's any correlation between clinical findings. Now let's jump into our financial dashboards, which provides various pieces of the financial health puzzle all in one place. On this screen here, we can track payments, adjustments, outstanding balances against billed charges to help the practice visualize their reimbursement rates. Next on over, we can show various payment sums with the ability to break them down in multiple ways. No need to build dashboards from scratch in Excel or Power BI. Next, we can review the claims, where we can view the claims by statuses to help the practice identify any bottlenecks in the claims processing cycle. And what better than to track all of your clinical referrals, where here we can view the patient encounter volume by rank and over time, helping to identify trends and relationships with referrals in the area that need attention. How about saving some time by auto applying patient payments en masse? We've actually tested this, and on average, we will save staff time roughly 40 hours a month. In fact, towards the bottom, we've enhanced our ERA payment with callouts to pertinent warnings and errors to quickly grab your attention. Within Nextech's practice management software, you can identify some scheduling settings for online scheduling for payments. Jump into our appointments, where here you can mark which appointment type are available online. You can even identify any pre-payment types. In our providers, you can mark the ones that are available online, even attach images to make it easier for your patients to recall your physicians. And lastly, within the location, mark them as available and even attach a friendly name to make it, again, easier for your patients. Now, here's a quick glimpse with the online scheduling. Your patients can mark the appointment type, purpose, location, start time. On the left-hand side, here's where those images come in handy for your physicians to be identified for your patients. They'll select on that patient, the scheduler will adapt. And in this case, I'm going to select on 10:30 in the morning. We'll hit continue. And as a patient, I can now document my first name, last name, date of birth, zip code, mobile number, email, and how do I hear about them. Once completed, I can finalize my appointment by selecting book appointment.
All right, so there's some real results for our practices, and just sharing a few of those, just some simplicity. Load-in vision centers in Tennessee actually saw 2 times as many patients with our software in comparison to what they were previously using. Solve Vision came from a competitor of ours, and actually was able to chart less than 2 minutes per patient, which is just incredible. Could not do that with the other solution. And then there's this unmatched service and support. We have a pretty large organization called USI, was able to see all their patients on day 1 of their implementation when converting to our EMR. And then just outstanding patient experience, again, dealing with patients, filling out information before coming into the office and being able to do that very quickly. Also saving a lot of time for the practice themselves, filling out paperwork. So get energized. This is an efficient, state-of-the-art, the GOAT of software is right here. It will reduce staff turnover by lowering those frustrations that they are battling each and every day, eliminate the billing errors that are constantly happening within the practice, and then also avoid having to sacrifice patient care, which is ultimately, you want a system that you can document and track patients in the best possible way, and this allows you to do that. So if you have any questions about what you saw today, or even some more things that we weren't able to due to time, feel free to reach out to sales@nextech.com.
Have a good one, everyone.